This periapical radiogram of the premolars and the molars show us actually different uh, uh, types of carious lesions and fillings. You will see that there is an amalgam filling on the root of the first premolar, which might have been affected by root caries or a treatment for root caries. The filling seems to be fine. There is no radiolucency that is around the filling, which indicates that, or that might indicate any recurrent caries. Now, looking at the second premolar, you will see that there is a large punched out radiolucency that has affected the crown, that has affected the root of the tooth. This lesion, that big, is most likely a combination of root caries that is located on the mesial surface of the tooth plus the buccal or the lingual surface of the tooth. Lesions like these are quite frequently seen in teeth with periodontitis. So the lesion, just like in the lower four, has affected the buccal surface. Now I want you to have a look at the pulp of the tooth. Is the pulp involved in this case or not? No, I'm not sure, because I can't tell whether it is involved or not, but there is a radiolucency on the buccal or the palatal surface of the tooth, or buccal or the lingual surface of the tooth, that has cast its shadow on the pulp, which gave us this appearance of an involved pulp. Do not assume that the pulp is involved unless by clinical examination. Looking at the lower six, you will see that there is a crown on the six, and apparently that there is a recurrent caries underneath the crown. Again, this is a segmental carious lesion because there is a root exposure, as you can see in the regression of the alveolar crest, and it has affected the root on the mesial surface. And if you can trace in this area, you can also see that there is another cavity which is affecting the buccal side of the root. Why would I say the buccal side? Because the radiolucency is not as sharp as that seen in the lower five. So it is most likely a lesion that has gone from the buccal side, from the buccal side to the distal side of the root. Another cavity, root caries, has affected also the buccal surface of the lower seven. Why would I say the buccal, not the mesial? Because if you draw a line, if you trace the root surface, you will see that the root surface is still continuous. So it means that there is no discontinuity in this surface, but the continuity is present, but the cavity or the radiolucency is present on the buccal surface of the tooth. But if you draw a same line trying to trace the distal surface of the lower six, you will see that the root discontinues. The line is not continuous anymore, so it means that it has been affected by the mesial cavity.